about the severe shortage of medical staff throughout this crisis. Many doctors and nurses have described being pushed to their limits. And one doctor, Taylor Nichols, healthcare workers. One study found that 57% have experienced acute stress and 48% exhibited depressive symptoms. Now, the doctors and the nurses tell us they've been working relentlessly for months, and now they are dealing with new challenges and fears as a number of
Advisors in hospitals struggling to cope. There are the hidden mental health costs of the pandemic. One frontline doctor who preferred not to be identified described feelings of helplessness and despair. Staff shortages after a decade of funding cuts, depleted.
Devastating health systems worldwide. Hospitals are often understaffed, doctors and nurses overworked, many without life-saving protective equipment. Some doctors and nurses are being threatened with dismissal for speaking out against working conditions and the lack of protective equipment.
What we need to do to deal with this crisis goes against our monster capitalism system. Here's another example. The president and the authorities have told manufacturers not to price gouge on things like face masks and hand sanitizers. You know what price gouging is? It's the natural behavior of the capitalist market. Trying to stop it is like telling a lion.
Fixing of the interest rates, the fixing of the ratio, all the government subsidies, etc., which is basically socialism, the absence of the free market, no free market money, you're sitting there with a central banking system, they've taxed you half to death, forced you into a collective group where they stripped you of your individual rights and liberty. You could go through a whole host of things. You're even sitting there with a sizable public sector, living in a mixed economy, but apparently you're living in the crisis of capitalism.
The world economy is headed for a recession. China won't be there to save it this time. Northern Ireland's health service at breaking point. South Korea set for one of the worst growth periods in half a century. The richest person in the world just gave $98.5 million to help the homeless.
They don't want to acknowledge the fact that socialism's present and socialism's been the actual cause of the problem. The one thing that she is right for saying, however, the crisis has been long going long before the pandemic, long before the lockdowns. The lockdowns accelerated the recession forward, and something far worse is ahead.
Why am I reading these headlines to you? Well, it's to prove a point. These could all have easily been post-pandemic 2020 headlines. In reality though, they were all published in November 2019, a month before COVID-19 had even been heard of. Because well before the coronavirus pandemic hit, much of the world was already deep in a crisis of capitalism.
But that wasn't to blame on capitalism, that was to blame on her socialism. It's because of her socialism that fixed the interest rates below market value, that drove up consumer demand to go out and borrow and spend more during a period when there's a shortage of savings in the economy. That's what creates the boom and then the eventual bust. You saw that with the lead up to the Great Depression in 1929. The fractional reserve banking, what's that got to do with capitalism and the free market? Nothing. A system, despite the fact where you're seeing the private sector over-regulated.
And now, with millions out of work, entire industries utterly stagnant, and healthcare systems scrambling for a vaccine, the question is, did capitalism turn the COVID emergency into a disaster?
Well, given the very fact the American main healthcare market is not capitalist, you're basically going to shoot yourself in the foot with that argument.
Capitalism. It's an ideology, an economic system, a political statement.
But how has a system based on private ownership and the pursuit of profit served the world in a time of crisis?
Capitalism is not an ideology, it's a system that pertains to human nature, and of course you can see that evidence with the self-interest that individuals have in society. Profits serve the people. People are who drive basically what profits are.
When the situation demands we act not for individual gain, but collective benefit.
So how on earth can you collectively benefit society by price controls?
It's not because there's no energy available. It's simply that we've called for more energy to be delivered to a given place,
which distorts the information of profits and losses, destroys price signals, destroys the very information of consumers' needs and wants. How then can you benefit society? After all, if you're going to centrally plan food, healthcare, education and everything else for that matter, you're going to end up with a serious problem. Not only with surplus waste problems, but of course shortage problems and all sorts. Mind you, that is of course if you ignore the history of the likes of the NHS that's been faced with those problems for decades.
Stay at home and protect lives.
They've said test, test, test.
Without preventive measures, there could be a spike in cases.
All these cancellations are a way to flatten the curve.
COVID-19 hasn't been like any other crisis. Job losses, healthcare struggles, a critical need for relief from the state have all struck segments of society that normally don't face these kinds of grave economic stresses.
In short, all of a sudden through this pandemic, this once-in-a-century type of crisis, it's become evident to many that pre-COVID times were also a crisis of sorts.
That crisis has been created by people like you, because your government intervention in the economy gave rise to the cartels, the oligopolies, the monopolies. You basically enabled the giant supermarkets to gain dominance over the market, where as a result of the absence of free market competition, it was allowed to form a collusion and shaft the farmers. You know, it's no different to the American healthcare system, where as a result of the absence of free market competition and due to a government's third-party payer system, you basically enabled private pharmaceutical companies to get away with a collusion to create that very problem. And when you bankrupted the nation through all your heavy social security, your higher tax rates, over-regulating the private sector, doing all of those things thanks to your socialism and subsidising the arse out of banks, creating the liabilities that bailed out the banks that cost us trillions of pounds. Of course, after driving our debt level through the roof and all the rest of it, you then have the audacity to sit there and say that capitalism is the crisis.
As entire countries went under lockdown earlier this year, I spoke with a group of people whose work has been all about dissecting and analysing capitalism.
When people say they want to go back to normal, who can blame them? Because that sounds pretty good to me right now as well. But the thing about normality, as we think about it in terms of economics and politics, was it was actually pretty sick. A lot of the people right at the top of our society did pretty well out of that normality, even if it meant that other people didn't have a proper roof over their heads, even if it meant there wasn't enough food on the table to feed the parents and the kids got to eat but the mum went hungry. That was the kind of society that we lived in, and I'm talking to you from one of the richest societies in human history, and yet we didn't have the money to do that.
Again, you stripped away the free market money, you increased the quantity of paper and circulation of the economy through all the printing press, you encouraged the government borrowing and spending through fractional reserve banking, through your socialism, where the socialist bankers encouraged all of that government borrowing and spending, and all because people like you don't understand the laws of supply and demand. You basically drove the cost through the roof, and then after you've done so, you then blame capitalism.
In my opinion, capitalism is the pandemic. That is the root cause of so much of the suffering we're experiencing now. I mean, I want things to go back to normal. I want to be able to go to a cafe. I want to be able to see my friends. But I don't want things to go back to the normal that we've been living with for the last 40 years of wealth concentration, of exploitation of working people. That's the paradigm, that's the context that set the stage for our current calamity.
I've pointed out time and time again about the late 19th century. This was the period in the United States, the myth of the robber barons. Now, during that time period, you can see that wealth remained the same, with 70% of the wealth going to that of the workers and that of capital and resource suppliers. It was about 30%. There was no dangerous concentration of wealth in the hands of the few, and this was during the period of the myth of the robber barons. Of course, she's the type who goes around claiming that there was these, evil monopolists during that period where they drove the costs up to shaft the consumer, all the usual left-wing nonsense. That's what happens when you've got people who don't even understand what they're bloody well talking about. They just make baseless claims, and people who don't know any better just buy into it.
This virus has intensified a spotlight on healthcare, what it costs, who gets access, and its ability to respond in a crisis. One system that runs shockingly counter to the needs of so many it's supposed to serve is the one in the United States. American healthcare is largely privatised and lacks pricing regulation, both key traits of a capitalist system. This means not only is every element of the healthcare system, from hospitals to drug manufacturers, owned and operated by the private sector, but those businesses are free to charge whatever they like. This makes staying healthy in the United States a scarily expensive proposition. There's a small percentage of the population, about 18%, that does get some state support for medical costs. But for the vast majority, private health insurance is the only recourse. They charge notoriously expensive premiums, making them unaffordable for many, and are filled with loopholes and gaps that mean even insured Americans can be left with hefty medical bills to pay.
So first of all, folk, I've done 2 videos on the American healthcare system. There's actually 2 American healthcare systems she doesn't know about. First of all, I want you to check out the video that's on why American healthcare costs soared out of control. And then after you've watched that video, you should go on to watch my second video, which was on direct primary care. Direct primary care is the free market model. That's the capitalist model of healthcare. American healthcare costs got out of control was because of her socialism through a cartel, otherwise known as the American Medical Association, and then of course there was the overregulation of the private sector. However, what she mentions was something to do with cost.
American healthcare is largely privatised and lacks pricing regulation, both key traits of a capitalist system. But those businesses are free to charge whatever they like.
Oh, it's not magical. She says it was fully privatised, didn't she? So privatised that the private sector was overregulated by the state. What does this guy say?
Part of the reason is that the giant hospitals actually like the regulations that put their smaller competitors out of business. And these giant and awful regulations that the hospitals oftentimes complain about behind closed doors, they're celebrating because they know that while they're onerous to some degree for the giant hospitals, they're completely debilitating for their smaller competitors.
And it was so privatised that along came the third-party payer system imposed by the government, which is not capitalist at all. Do you know what a third-party payer system means? It means that someone else other than the consumer gets to determine the cost.
In the United States, people can't access healthcare because they can't afford health insurance. Even if they have insurance, they are buried in debt after the fact. What happens when something like the coronavirus hits a population that's indebted? You're devastating a population that has no savings, right? 40% of Americans before the crisis were reported to not be able to handle a $400 emergency.
As I mentioned about the direct primary care model, and of course you can check that video out, it removed 80% of the health insurance because most of it's unnecessary. I'm not going to go too much into that. You can check the video out for yourself. What you see is a more simplified model. The problem with this main American healthcare market, they started introducing insurance for absolutely everything. That's not capitalism. Capitalism is about simplifying it.
America's healthcare crisis has intensified during the pandemic. A tidal wave of layoffs have meant that as many as 27 million Americans have lost employer-provided health insurance. And without that cover, a hospital stay to treat COVID could cost as much as $73,000. This is despite a government plan announced in March to cover some COVID-related medical bills.
America's been living under corporatism. If you were living under a free market economy, you'd be able to get PPE much quicker into the country, and no healthcare system would be able to deal with such a pandemic perfectly. But what the free market would do, dramatically reduce the time in order to get vaccinations out of there, and it's actually thanks to capitalism that was responsible for that, actually, through the profit motive. The other thing is the fact that PPE, etc., again, capitalism through the free market would be able to get much more of that quicker, and that's the very reason why I pointed out the fact, having left the European Union, it contradicts our narrative, because there you see Great Britain got vaccinations much quicker than that of a strongly centralised regime known as the EUSSR. According to her logic, we would have been so better off in the European Union, really.
The lack of coordination and the need for medical supplies to keep turning a profit has led hospitals into bidding wars over crucial supplies like PPE masks, tests, and medical equipment.
Doctors and nurses warning that critical protective gear is running low.
This is a hospital where the healthcare workers have taken to wearing garbage bags.
It's like being on eBay with 50 other states bidding on a ventilator.
The hospitals are run for profit, and so they don't have adequate staff, right? Because that would eat into revenue. They don't want to have extra medical supplies just languishing, not being used. So what we're going to see is a lot of people who are going to perish, not because of the virus per se, but because of the lack of access to adequate healthcare, the lack of access to protective gear. We're going to see people who don't seek treatment because they're afraid of not being able to pay for it. It's already been reported by emergency room doctors that people, their last words are literally, but who's going to pay for this?
Profits is the information telling you how much to produce, what to produce, where to allocate the resources. In other words, if you've got PPE, the profits is price information signals saying, here's the parts in the market where profits are, here's where you need to provide. See, if you take away profits, you no longer know that information. The main problem was the economic degeneracy of her to start talking about shortages of PPE, etc. She was the one arguing for price controls. Do you know what it means to set down price ceilings? It creates price shortage problems.
One of the big problems with capitalism is that capitalists direct investment. So capitalists say, what's really important? Viagra, because that's a huge market. Even though the coronavirus exists, let's not invest in a vaccine because that market doesn't really exist. And also, do we really want to vaccinate the whole world in this preemptive measure? No, let's create something that we can sell now. So, we let capitalists direct investment at our collective peril.
This is the idea that you think capitalists are the ones who drive production. It's the consumer that directs investment. An investor is only going to invest if they know they're going to make a return. If you end up creating and producing and investing in something that's not going to sell, you face the risk of facing a loss. So you don't even understand investment in the first place. This is how embarrassingly economically illiterate this person is.
Whenever a vaccine is hopefully created, the next battle, at least for patients in the United States, will be over affordability. And that's when we're back to one of the fundamental potholes of the American healthcare system, where unlike in almost every other nation, basic pricing controls simply don't exist.
You'll remember a video I did, folk, and the mentality of socialists, whenever they see a higher price in the market, they think it means greed, right? Because they're just clueless about economics. They've never studied it. So what's the first thing that socialists do when they see higher prices in the market? They set down price ceilings. That's exactly what results in all of the shortage problems.
Some of the wealthiest people on Earth, founders and CEOs of mega corporations, are making headlines for donating to COVID causes through their own philanthropic organisations. But it's not just about the money. It's the perception that it comes with all the trappings of the corporate world: efficiency, returns on investment, streamlining of operations. All of this has transformed what was once simply charitable giving into something else: philanthrocapitalism. Linsey McGoey has written about it extensively in her book No Such Thing as a Free Gift.
I think we have to move past the headlines sometimes. Mr. Gates did talk about the need for mass testing at an earlier stage than some US officials, and that was a good scientific approach to take. But I really do question whether or not their efforts were anything more than a Band-Aid solution, because there was no evidence that they were really having much of a positive effect on the sort of really deteriorated and ramshackle approach that was underway in the US more generally.
I think what we're applauding when we see a billionaire dipping into their own trouser pockets and handing over some cash is we're applauding the myth that capitalism works for everyone, that anyone could be that billionaire and be the ordinary guy who hands across the money. And that's not the case. Their billions are a collective creation, not their own individual creation. Every billionaire is a sign of capitalism's failure, because no one should have that amount of money.
In other words, they're dictators, they're control freaks. They basically want to restrict you from being able to make as much as you want. What gets me the most is the fact that 100% charity is capitalism. Socialism is not charitable. Capitalism provides charity. You strangled capitalism half to death. You imposed a system of all the government welfare programs, destroyed the community spirit. You then sit there and blame capitalism for not being charitable.
No, the point here is that philanthrocapitalism is too often used as a distraction from more meaningful, possibly more expensive, systemic changes. Rampant corporate tax avoidance, the suppression of minimum wage levels, reliance on state subsidies, precarious working conditions. I mean, the list of what actually needs to be addressed is long.
Now, tax evasion and tax avoidance are not the same thing. You don't understand, we're not chess pieces on a chessboard, and people are not going to stick around to pay for your socialist crap. And this idea you think it's just a case of just raising the tax rates, that's a bit like the idea of laying down the Berlin Wall and thinking that people won't escape it.
This is not an accident, right? I mean, this is the product of a political strategy that's been going on for the last 40, 50 years, whereby taxes are slashed and private wealth accumulates. And what that private wealth does is it concentrates power, and that threatens democracy.
You look at the 19th century, and this was the period, again, of the so-called robber barons, and you saw the wealth remain the same. It's sad that I have to repeat myself on this, but you can look at the United States of America under Ronald Reagan. Do you remember how these people said that deregulation would lead to crisis, and it'd lead to the rich getting richer and the poor getting poorer? Between 1975 folk to 1991, the rich got richer and poor get richer faster.
So we have this really negative feedback loop where the more dysfunctional the state is, right, the less it's able to provide basic services, the less it's able to protect our public health, the more ammo there is for the corporate sector to say, hey, look, the state is inefficient, the state is incompetent. We, with all of our resources, can save the day.
No, the reason why it's inefficient is because you don't understand basic economics. You don't have a clue about prices. I'm in Scotland. My country faced heavy nationalisation. By Christ, state education has been an absolute abysmal failure. The Royal Mail went bankrupt because of nationalisation. And of course, the British railway industry, I should mention as well, had outdated trains. You don't understand the economic calculation problem, in other words.
There's a term that's gained renewed currency during this pandemic: disaster capitalism. Canadian activist and author Naomi Klein came up with it years ago in her book, The Shock Doctrine, and it went viral during the 2008 Great Recession. It points to how disasters, like a recession, a war, or a pandemic, aren't necessarily catastrophic across the board. In a capitalist system, they can also present an opportunity for the money-minded.
And we've seen a lot of profiteering during this current pandemic already. I don't think we've seen yet the limits of that profiteering, but we've got an early sense of which sectors and companies are starting to, for example, price gouge when it comes to basic health necessities like masks that are, for example, being charged at upwards of 15 times their usual cost.
So folk, when it comes to the profiteering, there's no denying the fact that there's no such thing as a perfect system, but it doesn't solely mean to say that just because the price went up that it was due to somebody that went in, bought up a lot, and then started selling off at a higher price. The higher price does serve a purpose. If there's a shortage of a resource, the higher price serves its purpose to reach to, people who are in greater demand of it, greater need of it. Socialists don't understand the laws of supply and demand. They don't understand scarcity, so she doesn't understand the fact that when demand far exceeds supply, and this was largely the case for why prices were soaring during the pandemic. That's not to say, of course, that there weren't those that were taking advantage of it. Again, there's no such thing as a perfect system. But what's our solution? Socialism? Hyperinflation? This is coming from the same people who are calling out for price ceilings.
But disaster capitalism can also be less direct and more obscured from public scrutiny, like who stands to benefit from some taxpayer-funded bailouts. Take the US airline industry, which had its request for a $50 billion bailout approved by the US Senate in March. While the loans were conditional on job protections, the sticking point for many is that over the past 5 years, the big four airline companies, American, Delta, Southwest and United, have not only made record profits, but collectively spent nearly the same amount, $45 billion, on stock buybacks and dividends, two ways in which companies can directly enrich their corporate executives and shareholders.
In other words, she's basically blaming for what is socialism off onto capitalism. What the hell is socialist government subsidies, where you use the state, where you force society into a collective group and you force society collectively to pay for the losses of others? Since when was that capitalism? That's bloody well socialism.
So you have a form of capitalism which does not live up to its billing. Because a real capitalist, red in tooth and claw, would say, well, capitalism works when the weakest companies go to the wall, and when things that aren't working and bad ideas, they fail, and the people who support them, they fail too. Well, that clearly hasn't happened in any society under this pandemic.
So in other words, he's basically just clarified the fact that he doesn't even understand the 19th century of American history then. Because see the political entrepreneurs who took on the government subsidies, all those companies faced bankruptcy. An example of what you saw of capitalism was Iceland. They let the bad banks fail. They let them liquidate.
And that's probably a good thing. When we come out of this, I think we can certainly say that the old mantra of public bad, private good, that doesn't work. And I think we can also ask some questions about why is it the losses are socialised at times of crisis, and yet outside the crisis, the gains are always privatised. So we need to have a proper rethink of the kind of capitalism that we want coming out of it.
And then he goes on about that to do with socialising the losses and privatising the gains. That's corporatism.
The efforts to rethink capitalism have been going on almost as long as capitalism itself has existed. And to be fair, it's practiced in notably different ways in different parts of the world. But one of the most toxic and recurring problems is that in too many cases, the system seems designed to favour a small, elite segment of the population.
No, you weren't. No, you didn't have this dangerous concentration of wealth in the hands of the few. You just made it up. That's what you socialists always do. You socialists have made up myths after myth after myth. You did it with the Industrial Revolution.
We hear this phrase, that we need to save the economy or we need to keep businesses going. It makes sense. But I think we have to ask a deeper question, which is, well, what's an economy for? Look at something like GDP, gross domestic product. All that means is that there's more affluence, but it has nothing to do with distribution. It has nothing to do with the quality of people's lives. You can have enormously high GDP and have, record rates of homelessness and unemployment. So we have to deconstruct this idea of the economy and put people at the center.
The one thing that she's actually right about in what she says there, just because you have a high GDP, it doesn't necessarily mean to say that you are productive in the sense of being efficient. It's capitalism that enabled that efficiency. It was through market-driven prices that enabled that. So the market is actually what enables the people to be put first, because that's what profits and losses are all about. And what contradicts her is the history of Singapore and Hong Kong. Now contrast that to any socialist economy that you could possibly find. In fact, contrast that to every single mixed economy like that of Norway, Sweden or Denmark, who have tore the arse out of natural resources and are sitting stagnant.
We are living in failed capitalist states at the moment, and that's been clear from the COVID crisis, because the so-called wealthiest nations could not prepare their own companies or their own publics sufficiently to prevent avoidable deaths on a massive scale. Clearly, the wealth gains of the past sort of century have not been fairly shared. They've been hoarded by a few, while some people are left far more vulnerable by market processes than other people.
She's talking crap, folk. A free market would allow you to gain quicker access to such things. This is coming from people who don't even understand the economic calculation problem, don't even understand what price ceilings are and what they cause. And I think it's very difficult to avoid mass deaths, especially when some new virus pops up, and it's very difficult to avoid that regardless of what system you have. You've got to acknowledge the fact that we were very, very quick to get the vaccination. She actually takes that for granted.
The stuff that is really important, that is really a priority, is not the stuff that we were told beforehand. So it's clear that actually there is a merit for collective action, not individual action. It's also clear that there are some parts in the economy, some parts of society are just more important than others and shouldn't be taken for granted. Those are pretty basic things. You might call them the foundations of a civilized life, and they've been completely neglected in all of this attention that's been given to growth and to getting as much income into a country as possible without thinking too much about where that income went. I think we need to rethink the kind of capitalism we've got. I also think we need to rethink the kind of priorities we've got as a society and an economy.
They don't tell you that you're living under a mixed economy because, oh, that would destroy the narrative. After all, socialism has to have its presence somewhere in the mixed economy, doesn't it? They want to exonerate socialism of the blame and try and blame everything off onto capitalism and pretend that you are living under a capitalist system today. Anyway, folk, I hope you've enjoyed the video. If you've got anything you would like to add in yourself, comment in the comment section below. And be sure to like the video, share the video, and of course, thank you for watching, and I shall talk to you later. Cheers.